I'm telling you about my research paper, and I did the benefits of music therapy on cancer patients. So how many of you have been affected by someone in your family, friend, someone you know by cancer? Okay, well, cancer, by the definition of the American Cancer Society, they said it's mutation of cells in our body that grow way too rapidly, so they overcrowd our normal functioning cells, and this creates problems because it causes tumors, and tumors are just a buildup of our mutated cells, and these tumors can be either malignant, which means cancerous, or benign, that are non-cancerous. So different treatments that are done are chemotherapy, radiation, and surgery. So surgery would be to take out all the affected tumors and tissue that are causing the cancer. Chemotherapy can either be used through IV medications and other pill forms. It takes detrimental effect on your body. And then another one is radiation, and it acts kind of as an X-ray does, using those kind of lights and that kind of radiation. And a huge thing with the type of treatments is the pain. Pain is the most common thing that has to do with cancer and causing people to feel hopeless, depressed, and lost a sense of hope. So a lot of people, they turn to opioids, or they even turn to different analgesics, which many can be severe. They have severe side effects, or even cause addiction in some cases, and can be actually deadly. And some don't even take the pain away at all. So over the past few years, researchers have done many things to try to increase the quality of life and decrease the pain as well, and they found that music therapy is one that helps. So a definition of music therapy is the use of music with guidance of a professionally trained music therapist to reduce symptoms of suffering. So when using music therapy, it results in meaningful changes of physical, psycho-emotional, social, and spiritual processes. It's critical for the therapist as well to analyze each of their patients, because every patient is different in their needs as well, so not every technique works. So this allows the therapist to get to know the patient, hear the music they like or don't like, get to know if they like to sing or even play an instrument. And El Maglio from 2008 also said it's important to meet every need and use their wishes of the patient and focus on what they need so it'll benefit them more. Some music therapy options would be pre-recorded music that they're already listening to, that they selected of their choice, live music where they get to play or they get to sing, improvise, or even composing their own music to have a choice of freedom and actually creativity as well. So this, on your guys' left, my right, this is before music therapy and how patients feel both physiologically and psychologically. So you can see rapid heart rate, nausea, vomiting. These can all be from the treatments like chemotherapy. And then even psychologically, an increased anxiety, depression, hopelessness. They lose their role in society, they feel. They have to decide whether they want to hang on or let go. It's very detrimental. It causes fear, distress, and worry. But then on the other side, after they've been introduced to the music therapy, been involved in it, it decreases their pain levels. It acts as an anesthetic, and heart rate is slowed, they're calm, it's soothing, decreased respiratory rate, decreased blood pressure even, their anxiety is diminished, hopeful, no more fear, and a decreased worry. And this is all from Kay Ruchia in 2009. So here I have the expectations of the brain. So someone's outlook going into music therapy has a huge effect on whether it will benefit them or not and be successful. And some of the most expected benefits from it are social and recreational activities, a relief of stress and anxiety. They find support not only by the therapist but by family members, staff, caregivers. They enjoy music more fully because they get to really examine what the music is making them feel. They can examine and express their feelings and are able to communicate in a better way with caregivers, family members, staff, and the music therapist. And then A. Peterson and Mavridis, 2015, there's a little picture I have over there of the brain, and the red is the most stimulated parts of the brain, and you can see the music when introduced to music, language, and music, most of the brain, there's different parts of the brain where it light up more where it affects it, which is crazy because it's such like a natural thing for your body to release certain things and to heal you. So the major part of this is the nucleus accumbens, and that is the part where there's a pleasure center. So dopamine is then released, and it is a pleasure neurotransmitter. So it's released throughout the whole body, and just by listening to music, it increases the plasticity of your brain, so your brain is actually growing. So the more you listen and new activities come about, your brain keeps growing no matter how old you are. And it also is a decrease in the sympathetic nervous system, so it decreases anxiety, blood pressure, and all that cortisol coming from anxiety, it's decreasing it. And allows music to be that aesthetic and to escape the reality, create your own images, and kind of transcend it and to feel what you want to feel. So then a study done by Braddock in 2015, there were 31 adult cancer patients, and they were introduced with music therapy versus music medicine. And music therapy is the live music, instruments, singing, and whatnot. And then the music medicine is pre-recorded music that was already, they got to choose a playlist and listen to. So they were introduced to 2 different sessions of each and lasting 30 to 45 minutes, but had to focus on just that, no other activities were involved. So the ones in music therapy were involved in the singing music and being active into it, and then the other ones were just sat down and listened to the music that they had picked for themselves. And so they both noticed that they are equally beneficial in measuring their anxiety, mood, and stress. And then the music therapy was actually chosen that people would do that further if they had to pick an option. And it increased symptom management, helped bring back memories so they could connect with who they are, gave them hope for the future, build relationships, and allowed participants to process and express their emotions. And then music medicine allowed to give a feeling of the aesthetic, comforting, soothing, peaceful, familiarity of which they preferred, and they enjoyed listening to music by themselves to better help them focus. And then another crucial part is the palliative care, because this is by the National Cancer Institute, palliative care is given to improve the quality of life of patients that have serious or life-threatening issues and diseases, and it helps to relieve and overall suffering of patients and families. So this includes not only the patient, but it's including caregivers and family members to help along through with how they cope, and just by music to help them communicate with each other. And when someone dies, they can use that music to help them go through and remember the patient and how they were in the last few days of their life, and not if they couldn't even communicate with them before, but they can remember the smile and how they interacted with the music. And then, so my conclusion would just be that this is less invasive. There's no form of medication. There's no side effects to it. There's only benefits, really, because you can express your own emotions, dig down in what you personally feel, and you're not feeling any pain from it at all. It increases, ultimately, the quality of life. And individualized therapy, they focus on what the patient really wants to do to help them benefit from it and be successful. And it helps ease the patient and all of those involved. So not just the patient, but everyone else involved with the patient, and help ease their loss and bring back memories. Any questions?